I think that when there's a preventable illness you can do something to keep out of our school, then it's your obligation to do that.
Dr. Nelson Branco, no, not our wonderful producer here of Straight Talk, weighing in on this growing movement of anti-vaxxers, as they're referred to. And of course, in correlation to this, more measles outbreaks happening. And now we have 4 cases here in the city of Toronto. For more on this, I'm joined by our Sun News contributors, Faith Goldie and John Downs. I want to go back to April of 2014, when there were 400 cases in the BC Fraser Valley of those measles outbreak. And now, of course, then we fast forward to December of last year, big outbreak in Disneyland, in California. And now here in Toronto, 4 cases, John, but yet there are still.
Why are you starting with me? I believe in vaccines.
No,
Start with the nut job over here.
Okay. Let's start with someone who doesn't believe. You don't believe in vaccinations,
No,
correct?
I know. I do believe in vaccinations. I believe there are a lot of good ones out there. I believe that there are a lot of ingredients that folks would be better off to familiarize themselves with, such as mercury within the MMR, measles vaccination. But do I believe in parental responsibility and parental decision making? Absolutely.
Mm-hmm.
Both my parents are employed within the medical profession. I'm not totally, an idiot and dim-witted about these issues, but they will tell you that part of it is knowing each vaccination, but then also the circumstances of those vaccinations. You want to make sure these were not left out overnight. You want to make sure that the fridge temperature was proper. You want to make sure the expiration date is right. And don't just look for the fun fact sheet that they give you at the pediatrician's office. Look for the actual slip within the vaccination vial. So am I anti-vaccine? No. Am I vaccine anxious? Do I hope that parents actually know what they're putting into the kid's body? And am I going to argue against Big Brother inside your child's veins? You bet your bottom dollar I am.
When the time comes, when you have a child,
Certainly.
will you get your child vaccinated?
For certain things, yeah, but I mean now.
For measles?
What won't you get your child vaccinated?
Well, simple stuff like the flu vaccine will not be there.
Okay.
When it comes to HPV, long-term studies are not yet done there.
Why wouldn't you get let's start with the flu. Why not the flu vaccine?
Because besides horror stories, the flu is just not that bad. I mean, I've had the flu at least a dozen times. I haven't died.
Do you know how many infants? Do you know how infants and the elderly are most susceptible
absolutely.
to dying of the flu?
No, and I understand that. But
So
do you
why
know how many
wouldn't you-
people get the flu after they've been inoculated, right? Like that's the whole thing here.
Do you want? Because I can bring in the medical officer of health. I can bring in the it would be the I don't know if the
Chief
Minister of
Doctor
Health,
guy.
but the chief doctor with the province.
Yeah.
Is there a conspiracy going on that all these doctors and medical officials are downplaying the benefits?
No, but there are several on
flu
the other
vaccinations?
side, right, who do not recommend this within their practice.
Who?
Well, family members that work within the profession do it, and there are a lot of people who do not abide by this, and it's their own personal freedom to do that, right? Because here's my philosophy.
But isn't it incredibly selfish?
No, it's not incredibly selfish. It's autonomy over my own veins,
no,
right?
but it is putting my child at risk.
No, it's not, because your child's vaccinated.
Right, but my child is 5. What about a child who's 10 months old?
Oh,
what about a child who's just
right.
a newborn? What about the elderly? They are still susceptible and exposed.
And there are
by
people
the
we know
decision,
can't have
hang on
the
a second,
vaccine.
the decision that then is being taken by that viewpoint is putting the rest of them at risk.
No, because as the parent of that child who is too young to receive that inoculation, then it's your duty then to ensure that the environments that you now expose them to are controlled.
Like a doctor's office?
I'll
Like
give you a good
in
example. There are a
Disneyland?
lot of doctors, by the way, now who are moving to not treat children that have not yet been vaccinated. That to me is against, every sort of ethical guideline.
Doesn't
when
that
it comes
tell
to
you
being a
something
doctor.
about the risks that are being put at anyone who goes into a doctor's office is being exposed to certain diseases, certain viruses, and those exposures can be offset by being vaccinated.
Not all of them. When I walk into a doctor's
Not
office,
all
I
of
understand
them.
there are going to be sick people there, right?
But you do understand
and so I'm going to be at risk.
If your doctor's office, when you go in, or if you go to a health clinic, do they have the hand sanitizer and the mask to put on your face?
Yeah, of course. Look,
Why do you think they have that stuff?
I'll tell you right now. I was primary caregiver for a person who was autoimmune compromised because they were going through chemotherapy. I made dang sure that everywhere I brought her was within a controlled environment. And guess what? Sometimes we end up in hospitals where so much was out of my control. You still try to mitigate that by doing what you can. And look, don't make any sort of mistake here. When it comes to hygiene, fluoridated water, so many things that we do within our regular lifestyle right now that have helped to contribute to minimize these sorts of outbreaks. And make no mistake, this is not an epidemic that we're seeing right now. 4 cases in Toronto is not an epidemic. Is it a bit of an outbreak?
The numbers are going up.
Yeah, and we will deal with it accordingly.
Because of people like you who believe that it's your
absolute
right.
So what do you want? Do you want the government to come in and tell you just how many shots your kid should have? Because by now, if there's 6, about 3 dozen.
If you have kids and you want your kids to go to school with my kids, you're not even coming through the front door
because your
without
kids
proof.
And my kids are going to be in the same age level, yes, and our kids are going to be immunized at the exact same time. And if they're not, then your kid will be, and he will then be protected from my apparently dirty, infected kid.
I don't want any students coming through the doors if they don't have a slip from their doctor that says they've been vaccinated for measles.
A lot of schools are doing that too right now.
But the problem is, this came up actually with the Minister of Health today, who said in Ontario, look, we have these exceptions in place for people of religious minorities or religious groups or for exceptional circumstances. Guess what? They're not being taken as far as exceptional goes. They are giving these kids complete passes just because mom and dad says, I saw an article, Jenny McCarthy said this, or I read something on Google.
Stop putting this on the ex-porn star, okay? There are a lot of big reasons why both people on the left and the right are saying, bugger off when it comes to the government telling me what to do. Do I think that there can be some sort of government supervision here? Certainly. Let's say I opt out of getting my kid immunized. I want to have a medical certificate that says that your doctor sat down with you and went through A to Z exactly why you should get your immunization, and you said no. And once that's signed off, okay, fine. But you cannot tell me
big government thing for you.
Then scarlet letter your kid, and when you're taking him or her around in public areas, the public then has a right to know that this child has not been vaccinated
so should we put a
and
little
is
yellow
exposed
star on his arm. Like it's so bizarre.
Or why don't we put all you anti-vaxxers in a small town somewhere up north? We'll airdrop food into you, but you're not taking fundamental responsibility for the exposure that you are prepared to allow for everybody else to have to deal with and eventually die for something that is extremely preventable.
Now, I cannot speak for all the Jenny McCarthys out there and the rest of it, but I beg to differ. I am taking the utmost responsibility of my child's health, and that is precisely
not if you're not doing the research and making
I am doing the research,
decisions.
And that's excuse me, and that's why I'm saying that I am going to do the research. But if you want to take care of the stupidest person in our society, then have that little certificate signed so it says doctor sat down with me, and yes, this person is informed.
I want to ask you about. I want to ask you about HPV. I want to ask you about HPV. Okay, MMR you're okay with. Mumps, measles, rubella, you're good with that. HPV, you have the human papillomavirus. You have an issue with that. That is what for young women to help them prevent cervical cancer and things like that. You have an issue with that.
No, I'll tell you right now, I have received the HPV vaccination, but it is not without knowing that there have not been longitudinal studies here. They don't exist. Okay. So anyone wants to tell me that is the case, you're lying.
You mentioned water fluoride in the water.
Fluoride is bad for you too. I know that, but here's the thing though, like you and I can disagree.
You've been to England?
Science
you have been to England.
I have, and bad teeth isn't the worst of situations. But the medical profession has had anti-vaccine and it has pro-vaccine studies that have come out on a number of vaccines. It is cartoonish for anyone to sit here and say, I am pro all vaccines and I am anti all vaccines.
Is it not cartoonish to say I'm not going to listen to the vast majority of doctors in the medical community who, I'm not going to bring up climate change, but I could here, who say this is definitely worth it. This will mitigate the risk when it comes to you and your children. And I got to say, if you really are doing the research, I can't help but think and declare that you are unbelievably selfish and ignorant.
No, because that 1 in 100 that dies from this or becomes paralyzed from that or autistic from that, or the fact that autoimmune deficiencies are way up on the rise, ADD as well. No, I am being responsible, and I'm saying my kid might be that 1 in 100, and I'm not going to take that. I'm going to do everything that I can within reasonable means to make sure that we have a balance achieved.
So you don't believe a doctor, if your own doctor and you have kids, a pediatrician says the risks are completely worth taking the vaccine, giving your kid the vaccine. The benefits way outweigh any risks.
No, then I'll believe him so long as I have the research to back it up. And again, there has been that quality control where I make sure that yes, he took it out, just moments before I actually came in to get my kid vaccinated. I make sure that the fridge is at the right temperature.
Do you eat at restaurants?
Yeah, I do.
You do? Do you go back to those restaurants and scan every little thing with one of those thermometer guns?
It's very different. I'm not injecting the poutine into my veins here, friend.
Oh, please. You're putting yourself at risk. it's like any other professional situation.
No,
you get on the
it's my
subway, you
kid's
get on the
health,
bus,
it's
you don't know
different.
if the driver's qualified, you assume they're not drunk.
And of course, they always come through. John Downs and Faith Goldie, wonderful, entertaining debate. But now I am going to bring a doctor in next, and
Gee, I wonder
no
what he'll
doubt
say.
Faith's going to pay attention to this one. Stay tuned for Dr. Brett Belchetz on this vaccination of measles. Stay tuned.
There's no doubt if you do a risk benefit of the vaccine versus the disease, I think it's very, very clear that you have one of the most highly effective vaccines against any virus, and you have a highly contagious disease, measles, that can have serious complications. So to me, it's really a slam dunk what the decision should be.
So if it were your child or grandchild, you would say vaccinate?
Without a doubt, and I've done that with my 3 children.
The head of infectious diseases in the United States very clearly talking about the need for vaccinating your children. Of course, with such preventable diseases like mumps, measles, and rubella, because we have vaccines for them, one has to wonder why this is even a question. Dr. Brett Belchetz is our medical affairs expert here at Sun News. I have no doubt you just watched that exchange between the three of us with somewhat frustration, because there still are questions. And look, I know that there is an individual liberty choice here for parents, and I understand all of that. But the point that I was trying to convey, and I know you can put it in much more efficient and medical terms, but those who don't vaccinate are putting the rest of us at risk, regardless if we have been vaccinated, correct?
100%. So let's go through what we've heard so far. So number one, there was a huge number of pieces of incredible misinformation that were said in the debate that we just listened to right before I came on. So
you can use air quotes when you say debate. By the way. It's okay.
So I keep hearing every time somebody who's anti-vaccines comes on, they say, this is a debate within the medical profession, that there's medical doctors that are pro-vaccine, that there are people in the medical profession that are anti-vaccine. I do not know one medical doctor that is anti-vaccine. And every time we push people who are anti-vaccine to identify those physicians that are anti-vaccine, I have yet to hear a name. Then they say there are studies that are pro-vaccine and studies that are anti-vaccine. Again, I have yet to identify one study that is anti-vaccine. Actually, there was one study back in 1998,
in the Lance.
and he went to jail
Yep.
because the reason his entire study was fraudulent, and he was trying to push an alternate product to vaccines. He was trying to make himself money.
Yeah.
He lost his license, went to jail. It was so criminal. That is the only study. There is no other study. So I heard in the previous debate somebody say, you don't want to take the chance of autism. There is no link to autism. There are no major side effects that occur on a regular basis from vaccines. So let's talk about the risk and let's talk about the benefit, because that's what the clip we just looked at said. So measles, so a lot of anti-vaccines people say, it's a natural illness. Everybody got measles, so that's okay. Well, no, it's not okay. So measles is a deadly illness. 1 in 200 patients with measles used to die from measles. So you're going to tell me you are going to not take a vaccine that has about a 1 in 2 million complication rate, which isn't even a major complication, 1 in 2 million complication rate. To avoid that, you're going to risk a 1 in 200 chance of death, and everybody got measles, because measles is 90% infectious.
Yeah.
So if I am not vaccinated and I'm in the room with you and you have measles, 90% chance I'll get it. Everybody gets it. Which brings me to my point of what you talk about, which is the risk that you're exposing others to.
That's right.
So measles has about a 21-day incubation period. So you walk around not knowing that you have measles. It can be infectious for a fair amount of that time. And if you're in the room with somebody who could not get a vaccine because either they're too young, meaning they're under the age of 1, or they're very sick. So there's somebody who's immunocompromised, they're getting chemotherapy, transplant, whatever it is, and you walk into that room with your case of measles, which you will have if you have not been vaccinated, if you've been exposed, you're going to give it to them, okay? And that person with no immune system that you're giving it to, their death rate is not 1 in 200. Their death rate is way higher.
Yeah, and where's the accountability for those that don't do it? The challenge, of course, is, look, we're not forcing people to do it, Brett. We can't say to a parent, you have to have your child immunized for them to literally leave your home. We're not at that stage yet. Maybe we need to get to that point. Maybe we need to take those who are clearly dismissing the facts before them, because it is so preventable. Last year, you and I were sitting here, and I mentioned it twice already. We talked about 400 people in the Fraser Valley getting measles, a measles outbreak. Yes, the U.S. is having their issue. Yeah, people will say to us, oh, Toronto, you have 4 cases. Oh, boo-hoo, it's suddenly a national crisis. But that 4 turns into 400 pretty darn quickly.
The average person with measles infects 16 other people, okay? So those 4 cases will turn into 64 very quickly if they are surrounded by people who are not vaccinated. And those 64, do the math, multiply that by 16, and very quickly you have a huge outbreak where people are dying. So that's not a joke, and anybody that laughs at those 4 cases has no idea what they're talking about whatsoever. They don't get the risk. So then we talk about, you say we can't force parents to get the vaccination, and that is the state of our set of medical ethics right now.
That's right.
But that being said, if I had children, I would not want my kids in a school where there were unvaccinated children, because the vaccine with the one shot you get at 1 year of age is 95% protection, and then you get the booster around 5 years of age, that's 99% effective. Now, if my child is one of those children that's in the 5% failure rate from that first shot, I don't want them getting measles from the kid that comes to school that didn't get the vaccine.
Tell me a little bit about what you've been hearing from the Minister of Health on this, Dr. Eric Hoskins.
So he made a statement today. Now, they were asking him whether or not he would tighten up the policy that we have right now on allowing children to go to school without a full set of exemptions. Because basically right now anybody can be exempted if they sign up and basically testify that it's a faith-based policy that they're going under, that they're refusing vaccinations because it's against their personal beliefs or religious beliefs. The issue here is that when there was an audit done a year ago, Global News did an amazing investigation across schools in Toronto to see how many kids were actually vaccinated and how many of them actually had gone through that process to do that exemption. The lowest rate, there was one school in downtown Toronto that had a 47% rate of kids getting MMR. So that right there, if measles breaks out, that is a hotbed for an epidemic to break out right there. So people are totally abusing this policy of exemption, and that needs to be cracked down on. So when I hear that, and I hear the Minister of Health saying, no, we don't have a problem, we're not going to tell people that they have to get the vaccine to go to school, I wonder what he's thinking, because he's creating circumstances right here that are predisposing us to have an outbreak, because that is where infection spread, is in an environment like a school.
I heard this earlier, and I'm going to kind of paraphrase as a line, but we're more paranoid about a peanut coming into a school than we are with a disease-laden child, potentially. That to me says that we have a very distorted view of what is safe and what is not in a school-related environment.
Think about it this way, and I agree with you. The peanut analogy is amazing. So you're not allowed to bring nuts to school because there might be a few kids with nut allergies, but you are allowed to be non-vaccinated and have the measles and go to school and walk around for that 21-day incubation period and potentially expose everybody. The risk profiles are not that different. Even, you see that we're closing down tobogganing hills. You see this the thing? So we're totally shutting down hills on the off chance that people could hurt themselves. So we are so protective across so many areas of society, but somehow we live so in fear of the anti-vaccination people that we're not willing to be protective there. The disparity and the hypocrisy here is unbelievable.
Do you think, in the little bit of time we have left, I know there's analysis for this to come, but should we force parents in Ontario, in Canada, to vaccinate? Should we force them? The big hand of the government coming in, and I know you and I aren't big fans of that, Brett. But
the short answer to this is, we talked a little while ago about the Michaela Salt case, and we said, should we force her to get chemotherapy? And the answer was yes, we should, because she's a minor and she doesn't understand, and it's not fair to allow others to make those decisions for her. So, in my mind, I hate to say it, when you are a parent and you have an infant that's 2 years old, that child, if they were an adult and could make that decision, they could make their own decision and say, I'm willing to take that risk. I don't think it's fair for a parent to say, I'm going to expose you to a 1 in 200 chance of dying. If it was anything else, if we said, we'll throw you on a rodeo that kills 1 in 200 people, we'd say that's child abuse. So why is this okay? So my answer is, I think at some point we need to say, yes, we should.
I agree with you. I really do. And I know it's a slippery slope. I'm loath to say it, but we often force people's civil liberties away for other hosts of reasons. All right, Dr. Brett Belchet's our medical affairs expert here at Sun News.